So what I'm going to do, I have an actual stapler here. This is the uh, same thing that was just seen in the video, and I have this is actually a model of a stomach with blood vessels coming off of it that are actually very similar in texture to an actual stomach that you might see inside of the patient, or the liver. It has the same consistency. And what I'm going to do then is I'll show you how this works. You can actually then place this stapler. I'm going to use one of these blood vessels here. You place the stapler across it, and then I close the stapler. I press this button to activate it, and then I will simply fire this handle 3 times. And if it has worked correctly, this thing that is down here, this blood vessel that I was trying to divide, it should now be separated, and there will be staples in it. Let's take a look. Sure enough, I'll put the stapler down, and I'll hold this up so that you can see close. There are very small surgical staples in there that would completely cut off the blood supply here, which is what I'm trying to do. And on the other side, there are staples there, and so it puts staples in each side, and then it divided between them. And that's a process then that we use to be able to divide the liver safely. So I actually, this is, by the way, this is a good point. So this is, again, this is the stapler that I was used to fire. These devices actually only fire one time. After they fire, you have to put a new head on it. Now the rest of the gun is still usable. I'll show you how this actually works. You actually take this part that is beyond this black spot, and you actually take this off. And so this part, the gun part, that can be reused over and over. But after the stapler itself is used, it cannot be used again because the staples have already been pushed out of it. So it's like a stapler that you would use to staple papers together. It's finished, it's out of staples. But you could get a new one and put in here in its place, and then you would fire it again. Sometimes during the operation, I'll actually use 20 or 30 of these, what are called reloads. They're very expensive. The price that we have to pay for one of these staplers for this device is about $150 for each one. And so it's a very, very expensive undertaking, but it's very worth it. So this is the stapler that we did. I'll show you the, this is the foam organ substitute. And what we had is, so you can see these blood vessels here that are coming off of it. I had one up here that was connected exactly the same way, and I used the stapler to staple them apart and actually completely divide it apart. And I'll hold this up closer. You can actually see there are very small staples in the tissue there. And so these staples, if you look very closely, there are 3 rows of staples. They overlap with each other. That's how it gets blood vessels to not bleed. So it's not just a single staple, it's a whole row of them. And they're laid down right next to each other in a very, very precise way. And that's how you can actually get organs like the liver to not have problems with bleeding after you use them.